Hi, James Smith.
Yeah.
I'm Lauren. I'm a student pharmacist at DeVille College.
Oh, all right.
Good. How are you?
Good.
I see that you're kind of busy, so but I see you're picking up a new prescription today, and I just kind of want to give you a brief counseling session. If you have just a few minutes, I don't want to take too much of your time.
Okay.
I'd just like to have your full attention so that you can get the best benefit from your medication.
Oh yeah, 5 minutes is fine. Yeah,
Okay.
absolutely. Yeah.
Great. So, just want to check some information, like your address. Are you still on 1 Main Street?
Yeah.
And your phone number is still 1234567?
Yep. Yeah.
Okay. Are you taking any other medications, like supplements or vitamins or herbals?
No, I'm not taking it.
And I see that you have no allergies. Do you have any other allergies that you've come across?
No, yeah, still don't have any.
Okay, good. So you've been prescribed to Norman, and the generic name is atenolol. And what did your doctor tell you this medication was for?
Just like for high blood pressure or something.
Yep, it's for high blood pressure. Exactly. And what did your doctor tell you to expect from this medication?
He said it would reduce it to a normal level or something, but I'm not sure.
So, your blood pressure should be reduced. After the first dose, it should start working within a few hours, and it should get the best effect after 3 to 4 days. How did your doctor tell you to take this medication?
He just said to take it once a day, but I'm not sure like how.
Okay. It's a 50 milligram dose, and you could take it at any time during the day, but if you start taking it in the mornings, just try to stay consistent with that so that it can get the best effect. It can be taken with or without food, and it's always best to take it with a full glass of water. So, and if you miss a dose, then just, if you take them in the morning, then, and you remember like really late at night, it's probably best just to skip that dose and move on to the next day so you're not doubling up on doses.
Okay.
There are a few potential side effects, but it doesn't mean that you're going to get any of them, but just something to look out for: fatigue, depression, nausea, dizziness, headache, drowsiness. Those are some of the common ones. Also, as a warning, just to make sure, when you first start taking this medication, you probably shouldn't operate like any machinery or drive until you know how it affects you, and you may be totally fine, so that's great.
Very good, yeah.
If you just store this medication like away from light and away from children in a cool, dry place, and you do have a few refills. You have 3 refills, so I'll be seeing you
Cool.
in the pharmacy.
Cool.
So I just want to make sure I didn't miss any key points. So if you can just say them back to me.
Yeah, absolutely. He told me it's 50 milligrams of atenolol, and if I take any time of day, but if I start taking it in the morning, just continue taking it in the morning, a full glass of water. You said something about dizziness, so when I'm taking it, just to make sure how I feel with the medication, to just, not drive anything, to make sure I'm okay with the medication.
Yep,
Yeah.
definitely.
And then I should start working pretty soon, so that sounds good to me.
Yeah.
Yeah, cool.
You seem like you're stressed out with your work and
Yeah,
busy guy.
absolutely, absolutely.
So exactly, just take it every day. If you want to start it in the mornings, that's great. It can be taken with or without food, and just keep it in a cool, dry place away from children.
Oh, that's perfect.
So if you have any questions, or if you feel like you have any adverse side effects and you kind of want to get something checked out, you can always go to the pharmacy again to check your blood pressure. I'd be happy to take it, and so would any other pharmacist here. So if you have any other questions, just contact us at the pharmacy at 343-5096.
Thank you
Okay?
very much.
Thank you, James.
I appreciate it.
Have
Thank
a
you
great
very
day.
much. You too. Thank you.